Alright guys, welcome to Hypothermia. Hope you liked that intro. First thing what we're going to do is talk about the 3 different stages of hypothermia. So you have mild, moderate, and severe. Mild hypothermia, 89.6 to 95 degrees Fahrenheit. Moderate is 82.4 degrees Fahrenheit to 89.6 degrees Fahrenheit. And severe is less than 82.4 degrees Fahrenheit. So within these 3 different stages, your patient's gonna present differently. Mild hypothermia, you'll have your patients that are really shivering, their skin is very pale, and they're very cold to touch. Your moderate hypothermia is going to be the patients that are exhibiting already some sorts of altered mental status. There's a little less shivering, a lot more slurred speech. They aren't able to get their words out as much, and a lot less fine motor skills. And your severe hypothermia is going to be your patients that are basically almost, if not already, comatose. They are unresponsive. Their pupils might already be fixed and dilated, and there's no shivering. They are still very cold to touch. 3 of these, there's 2 different ways that we worry about heat loss. We worry about surface heat loss, so from the outside, and also core heat loss. So surface heat loss is actually mostly lost from the groin, the lateral chest, and the neck. So make sure that when you do get these hypothermic patients and you keep them covered, if you're putting in a Foley, please make sure right after you insert that Foley, recover up that groin, keep them nice and warm. Their lateral chest, keep blankets on them, and then we're going to go over all the other types of rewarming. So core heat loss is actually lost mostly through the esophagus and bronchial trees, which I found very interesting. So there's ways that we can help rewarm their core through the esophageal warming, through you can do gastric lavage, Foley lavage, the NG lavage, NG-OG lavage, and there's also heated humidified air too, which we'll go over all those things in this video. Ma'am, since we're unable to get your oral temperature because your temperature is so low, I'm gonna have to get a rectal temperature through your rectum.
You wanna do what? No, just put it under my arm.
Well, a rectal temperature will actually give us a more accurate temperature than under your arm, ma'am.
So you wanna just shove that up there?
Oh, no, ma'am, I'm not just gonna shove it up there. I'm gonna be very gentle and use lubricant. Alrighty, so I'm gonna go ahead, get it all nice and lubed up.
You could have at least bought me dinner first.
All right, y'all, so our first line of defense for hypothermia will always be the least invasive. So in this case, it'll be the bear hugger. I'm gonna go over quickly which types of blankets we have available for the bear hugger. So first we have a pediatric under the body warming blanket available. We have an adult lower body warming blanket, an adult upper body warming blanket, an adult over the body, full body warming blanket, and an adult full body under the body warming blanket as well. So these are also interchangeable. If you can't find a pediatric one, you can always go ahead and just use the adult one. No harm done there. Just make sure that obviously after you inflate it, you go ahead and put a blanket on top, and let me show you the setup real quick. All right, so setup of bear hugger is actually very easy. All you do is plug it in and it turns on. There's no power button on it, which sometimes can confuse people. So plug it in and it'll turn on, and you have 3 temperature choices: low, medium, and high. Obviously, depending on how cold they are, decide which one you're gonna go with, and all you do is you click it and it turns on and starts blowing through here. And then to turn it off, say you want to change the patient or something, just press standby. and it turns off. So here we have a full body, over the body adult warming blanket here. I have my bear hugger plugged in. Next thing you're going to do is you're going to take this hose, and on each bear hugger blanket there is going to be a little opening there right here where you just insert that, push it through. Sometimes you need to use a little bit of force to get it in there, and that's perfectly fine. These blankets are disposable, so don't fret. And then you're going to go ahead and choose your temperature. I'm just going to click on medium here, and it's going to inflate. And once you do this, you want to make sure that you go ahead and place a blanket on top so that it doesn't fly away, and also keeps the warmth inside and closest to the patient. And I'm just going to go standby. Turn that off. Now I also want to point out here too is that this part right here, the part that you connect to the hose, should always be on top, and this paper-like side of the warming blanket goes on the bottom. If you look very closely, you can see that there's tiny little holes on the bottom, and that's how the warm air gets to the patient. Alright guys, so we're going to go over the Gamer machine and how to use it and set it up. I apologize that you can't see my very beautiful face, but my tripod is not wanting to work with me with a good angle to be able to see everything. So let's go over which each part is. So this part right here that plugs into here, it should probably always be plugged in. I mean, we shouldn't be taking this off of the Gamer unless it's to sanitize it. This part right here is your probe extension. So this is the part where your Foley probe and or rectal esophageal probe go. So that'll just directly plug into there so you can read your patient's temperature. And then next here we have the circuit loops here. They're going to come like this. They're going to come attached to each other. They should come clamped. These clamps have seen better days, so just make sure that they are clamped to almost the last one. Otherwise, you will get water all over the place. Okay. And then back here is the water reservoir. Let me go ahead and turn this so you can see a little bit more. So right here is where you're going to go ahead and pour your distilled water from the gallon. Alright, so say we're going to go ahead and start cooling a patient or warming a patient in this case, since this is about hypothermia. Let's get them nice and warmed up here. First thing I would do is go ahead and set up your circuit, which we will talk about next, how to set up that circuit. So go ahead, set up your circuit first, and then you're ready to go ahead and turn on your machine. So you're going to turn on your machine. This one will probably beep at me because the water level won't. Yeah. So here it's telling me to add water. I'm not going to add water just yet, just because I don't want it to be sitting in there for too long. And what you're going to do is you're going to press manual. You're going to press manual, and here, right here is your set point. So this is how warm we want the water to be when flowing through this circuit. So we're going to go ahead and set this to 102. Right down. Sorry. 102. Alright, so you're going to go ahead and set this to 102. Please make sure that when you are attaching the blankets, whether it be the green blanket or the disposable blankets, that you do have some sort of barrier in between the patient. So whether that be a sheet or something like that. Sheet would probably work the best because it'll still protect the patient but still allow the heat to be transmitted through there. So you're going to set this to 102. You're going to attach this to either your Foley probe or your rectal probe. And then the patient's temperature will be right here. This is what the temperature of the water is. As you can tell, it keeps going up because the machine is currently heating it right now. And it's telling me to check my patient probe and check the water flow. So if you can see closer here, this is actually a picture of a clamp. So it's telling you, hey, it's not working, something's clamped. So if you're getting this notification, make sure you check all your connections and all your clamps are undone. Check your patient probe. So this is telling me that it can't find what my patient's temperature is, and that's because I don't have it hooked up to anybody. And then it's also telling me to add water. So you're going to go to manual. Once you find that your patient's temperature is where you want it to be at, you can click on auto, and then it's going to keep that patient's temperature the same. So it's either going to heat or cool the water to keep the patient's temperature what it is. So say you heat up the patient to 97 degrees, and you're like, okay, cool, let's stay there. Press auto, and it will go ahead and continue to keep that patient at 97 degrees. And it'll change the water as it needs to, which is kind of cool. Another option we have here is monitor. So this would be used if we just want to monitor the patient. Say they're cold, but they're not too cold, or they're warm, but they're not too warm. And we don't want to do the whole blankets. We're going to start with a bear hugger and kind of see if that helps. So you're going to go ahead and just press monitor and plug in either your Foley or your rectal esophageal probe into here, and it'll give you your patient's temperature right here. All right, guys, now we're going to go over how to make your GAMAR a circuit when you have multiple blankets that you want to use. Okay, so here you have your connection that directly connects to the GAMAR. And say that this patient is very chilly, they're in severe hyperthermia or moderate hyperthermia, and you're wanting to warm them up rather quickly. So here we have the GAMAR blanket. This is not disposable, this is reusable. It goes back down to central supply afterwards and gets sanitized and sent back up to us. Then here I have two leg parts of disposable GAMAR blankets and an upper body, you can't see me, sorry, and an upper body disposable one as well. All right, so what you're gonna do first is you're gonna go ahead and unhook these two. Make sure that they are clamped when you unhook them, otherwise it'll be a wet mess all over the place. And you're gonna go from start off with the one that's closest to the GAMAR. So if your GAMAR is at the foot of the bed, like mine is right here, you're gonna go ahead and start off there. So I'll do the blanket first. I'm gonna go ahead and unsnap the blanket here. And as you see that there's a male end and a female end to both of these, and they just insert like that. So you're gonna go ahead and you can start with either one, male or female, doesn't really matter. I'd say ladies first, right? Let's do that. Ladies first, let's start with the female end and go ahead and attach it to the blanket's male end. Okay? Go ahead, attach it, snap it on, and then grab the female end of that one, and you're just gonna keep going around the bed. So I'll grab the female end, snap in this leg. I'll go around to this other leg over here since they're nice and close to each other, because this tubing isn't very long. I hope you guys can see what I'm doing here. I'm gonna sit on my patient so you can see me a little better. These tubings aren't very long. So kind of try to do the ones that are closer together with each other. So I did the male to female. Here I got a female. Let me unhook the upper body here. Woo! Woo-wee! I just got water all over the place, even though this is clamped. Probably because I sat on the blanket. And all over my shoe. So there's a blooper for you. Okay, so I got the female here. I'm going to connect it to the upper body's male. Go around here. And now I have two options. So I can either go ahead and reconnect this upper body to the actual GAMAR machine, to my last male piece right here. Or say, what if we have the esophageal cooler or warmer in? Then you can also use that too. So I've got that here And it also comes with the same attachments, male and female. So I'm going to go ahead and attach the female to the male and the male to the female. Sorry, there we go. All right, and there you have your circuit. So just start off with the one closest to the Gamar and slowly go one by one, male to female, male to female, male to female, male to female, and you got your circuit. It's a lot easier than we think. Okay. Okay, so next we're going to talk about the esophageal warming / cooling device that we have here. It is the Enzo ETM by Attune Medical. This, we only keep one stocked in the clean utility at all times. It is hanging over there by the dressing supplies. These do run about $700 to $800 a piece, which is why we only carry one at a time. So please use these as needed sparingly. I do have a training one over here that I want to show you. So this is what it looks like when it comes out of the package. This adapter here comes in the box, and that is going to attach to this middle port here. That lets us go ahead and insert our suction tubing in here so that we can use this as a suction device too, because if you look at the bottom here, we've got some tiny little holes here to help us suction out any gastric secretions. So this is going to come like this with a male and a female piece, just like the other Gamar devices. What you're going to do first is you're going to go ahead and actually hook it up to the Gamar and turn it on. It is going to fill with water. This needs to be filled before inserting into the oral cavity. It will not advance if it is not filled, because if you see how flimsy and flaccid it is, it's not going to work if you don't fill it first. Then lubricate it generously, and then you're going to just insert this like any other OG tube that you would on an intubated patient. All right. All right, so another minimally invasive technique we can use to warm somebody is this Ranger Danger right over here, Ranger Danger. So this is called the Ranger. It's pretty simple to set up. It has to be plugged in, and then there is a little power button right here on the bottom, and you just go ahead and flip that, and it will turn on. This is set to 41 degrees Celsius, which is about 106 degrees Fahrenheit. And as you can see, these numbers will start to go up. That's just the machine heating, getting ready to be at 41. So that's what that number means there. We have two different types of tubing for the Ranger. We have your standard tubing. This is what you're going to use if you have just a regular old patient that's a little bit cold but not too bad, maybe a moderate hypothermia, and we want to put some warm fluids. We also have warm fluids in the blanket warmer on that top door. There are a few bags of warm fluids. Make sure if you take a bag out of there, you replace it with the bag from the Pyxis. The other one here we have is called the high flow. So this is the big mama tubing. This is the jumbo tubing. This tubing's about this thick. I don't have any open, unfortunately, and I don't want to open one of these and make it unsterile. So these tubings are about this thick. These are the ones that you're going to use if you need to do like a massive transfusion of blood on like a trauma patient or anything like that. Because the tubing is so thick, it will actually infuse a lot quicker. And if you could see on this picture here, it actually comes with the tubing, and that goes to the actual bag of fluid or bag of blood that you're going to be hanging, and it has two ports there, so you can actually hang two at a time. This is also does have a micron filter, which means that you do not need an extra filter for the blood. So it's a two for one there. And again, these are the ones that you're going to be using on your very, very critical patients that need blood products super fast or that you need them warmed super fast. And it inserts just like the other one. So let's go over insertion real quick. So this is what the tubing looks like when you open it up. You're going to have this cassette here, and then tubing that's going to go directly to the patient, and then we need to attach our tubing that goes from our bag of fluids to here, right here. So I have a itty bitty bag of fluids here, and I'm just going to go ahead. This is already primed. I'm going to go ahead and attach it. It is clamped off though, okay? So it is clamped off. Rule number 1, insert the cassette into the Ranger before priming it. Again, insert the cassette into the Ranger before priming it. Because if it ain't flat, you can't go back. All right? If it ain't flat, you can't go back. So insert that cassette. All right, and now you can go ahead and prime it. Once it is inserted, you can go ahead and prime it. Open up all of your clamps. And again, the fluid in here will go as fast as it would if it was flowing to gravity. So if you do want it to go a little bit quicker, you can obviously do things like put it on a pressure bag. And it is priming now. So this whole cassette in here needs to prime before it'll start coming out of this little guy. And again, if it ain't flat, you can't go back. So once this is full, I cannot take it out of there. So please, 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 oh, there we go, we're dripping. So please, 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 always remember, if it ain't flat, you can't go back. Make sure it is flat before you insert it. Do not prime it before inserting the cassette. Okay, so we're gonna go ahead and turn it on. And then, like I said, these numbers will automatically go up. So it's at 30 degrees Celsius now. And it's slowly going to go up as the machine starts to warm the fluid. And that'll warm the fluid, and you just attach it to your patient like you would any other fluids. All right, quick little break. Let's take a second here and talk about our rectal esophageal probe here. So these are our rectal probes. Some of you may or may not have seen them before. And many people actually don't know too that these are also esophageal probes. So an esophageal temperature is actually the most accurate core temperature. So say you already have a patient who you've intubated, put in a Foley, an OG, everything, and then you go do the rectal temp and you're like, oh geez, great, their temperature is 92. Like, now I need to monitor their temperature. Like, I'm not going to take out their Foley and put in a temp sensing Foley, and you don't need to. So what we can do is you can go ahead and actually just insert this into the oral cavity. Just kind of guide it down by the OG tube and insert that there, and I would tape it to the OG tube. And then this actually attaches to, whoa there. This actually attaches to those new temperature cables, the ones that you saw in your email, because I know you open those emails I send you guys. So this is the temperature cable here. It's got a brown end, whereas the Artline one has a red end. And this just goes into the brown port, color coded. How awesome. Say your patient is comatose, but not to the point of needing to be intubated. Say they're just either they're an alcoholic and they're very intoxicated and they've been sleeping outside, and so they're also hypothermic, but they're protecting their airway. They don't need to be intubated. How can we monitor their temperature then, Kathy? Well, then you can go ahead and just insert this rectal probe. It's the same exact probe that you would insert into the esophagus. However, just insert it into the rectum just like you would with a rectal temp, and then just tape it onto that cheek. And you'll be all good. No more invasive than doing a single rectal temperature, only you don't have to continue to roll them and continue to do the rectal temperature because it's going to be reading on the new monitors. And if you guys haven't seen the temperature reading on the new monitors, it's awesome. It's huge. It's like this big and it shows the temperature very nicely. You could see it from across the hall. It's great, and I'm really happy that we got these cords, and I'm really happy that we're continuing to stock these. So please use these as needed. If you don't have a temperature sensing Foley in or something, go ahead and insert one of these into the rectum, or if they're intubated, insert it into the esophagus and get your most accurate temperatures that way. Okay. All right. So say you've tried it all. You've tried the bear hugger. You've tried the fluid warmer. You've tried the Ranger. You've tried the esophageal warmer. You've tried the warm blankets. You've tried it all. And this patient is still hypothermic, and we're looking for last ditch efforts here. So some last ditch efforts here are lavage. So we have gastric lavage and Foley lavage. There's also peritoneal lavage and thoracic lavage. I'm not going to go over those just yet, just because it's very far and few between that we will actually do those. So Foley lavage. So say you have your Foley in. If you do have a temp sensing Foley in, you will need to have some sort of other method of monitoring their temperature if you are going to do a bladder lavage, because since the thermometer is in there and you're going to be throwing some warm saline in there, then obviously you won't get an accurate temperature because it's just going to do the temperature of the actual fluids that we are going to be using. So here we have the irrigation bottles. I did store 3 in the blanket warmer. So, okay, so you're gonna go ahead, take your Foley, you're gonna unplug it from the bag. Right here you have this port, and you're just gonna take your syringe and saline, and you're just gonna go ahead and insert that there. And slowly, if you meet any resistance, please stop and don't do the bladder lavage or the gastric lavage if you're meeting any kind of resistance. And you're gonna go ahead and flush. And this is a 60 cc syringe, so we can go ahead and do at least 2 of those. Woo! Pop goes the weasel. All right, and go ahead and flush that one as well. And so now we can leave it in there for about a minute or so, and we can go ahead and, I don't know if many of you know about this little plug here. This is actually for like a 3-way catheter, a 3-way catheter. You can go ahead and use one of these, so it just pulls out and that part's sterile there, and insert that into the Foley. Let it sit there for about a minute, remove the cap, hook it back up to the bag, let it drain out, and repeat. All right, so same goes for an OG tube. So obviously we can go ahead and do a gastric lavage like this as well. And go ahead and do the same thing. Take your syringe, insert that slowly. If you meet any sort of resistance, then please stop. Do 2 syringes full, and then clamp that off for about a minute. And you got your clamp on top here. Clamp that off for about a minute. Hook it back up to suction. Suction out all that fluid and repeat. And again, this is like a last ditch effort. It's funny, I always thought that this would actually probably be the thing that would help raise their temperature quicker. However, because after doing some research, I actually found that this doesn't really help raise their temperature as much as we would think, because the surface area of your stomach and the surface area of your bladder are so small in comparison to the rest of their body. So it would be a lot better to try to raise their temperature through surface like the blankets or the Gamar warmers, or something like the fluids, the warm fluids, or even the esophageal warmer. That will probably actually warm them the quickest. So, all right, y'all. Well, that's hypothermia. I hope you guys thought that was pretty cool. Get it? Cool. Hypothermia. Next video should be coming out about next month or so. Again, please get these quizzes handed in to me and let me know what you guys thought. Thanks.